curious, how do smarter diagnostics actually move the needle on value-based care, and how does it compare in a system that's largely fee-for-service still?
So, non-small cell lung cancer is one of the few tumor types that has a liquid biopsy recommended in the guidelines. But because, like I said, diagnostics is exploding, physicians can't keep up. The guidelines change every 3 months. We only see 18% of patients getting this test done.
Okay.
And then what's even more concerning, as a clinician, a patient myself, is that this test will tell you which drug is going to treat the cancer, but
Mhm.
only 44% of the time are patients actually on the drug recommended by the test. So
Why is that? Is that a physician
I
decision?
it's a newer test, right?
Mhm.
This is just one tumor type among
Mhm.
many,
Mhm.
and there's just inertia. No one's fault, but this is just the reality. That, it takes 17 years for evidence to get translated into practice.
Yeah.
But also the administrative burden of all of this is overwhelming. So what we're doing is helping to identify which patients are going to need this test,
Mhm.
and then we're also reducing that prior authorization burden. If we know based on data and diagnostic intelligence that a patient needs a test, we don't want to make it hard for them to get
Mhm.
it. Because especially, you think about lung cancer, if patients aren't getting the right drug, that means we're wasting money on really expensive treatments that aren't effective.
Mhm.
So we want, when patients meet those criteria, we want to make it as easy as possible for them to get that right test and get that right treatment.